Yeah, Dipashri, you can start.
Ah, welcome to all. Good evening, everyone. It is my privilege to extend a warm welcome to our chairperson of Central AHA, esteemed chief guest, Dr. Sushma Desai, MAHA AHA chairperson elect 2027, Dr. Jayant Pandharikar sir, MAHA AHA founder secretary, Dr. Sangeeta Lodha, respected speakers, Dr. Shama Kulkarni, ma'am, and Dr. Sadachar Ujaramkar sir, and all participants joining us for this important, insightful online session on adolescent health related to turbulence in teenage. Risky behaviors in adolescents are actions that can harm their physical health, mental health, academics, and even the future opportunities. Now we will hear from our esteemed speaker details to it. But prior to it, Chitra Kulkarni ma'am, I will request to introduce our chief guest and our guest of honor uh, and request to have their blessings from them. Chitra Kulkarni ma'am, please give introduction of Sushma Desai ma'am
Thank you
and
very
Jayant
much,
Pandharkar.
Dr. Dipashri. We extend all a warm welcome from Maharashtra AHA. This is our dream project to bring out talented speakers from periphery. And I'm very much thankful to our Central AHA chairperson, Dr. Sushma Desai ma'am, who has accepted to be chief guest. She is director of Gopi Children Hospital and Tarun Adolescent Healthcare Center, Surat, Gujarat. And she is practicing adolescent medicines for last so many years, like from 2017. She was president of Surat Pediatric Association and scientific module coordinator for so many subjects where the adolescent medicine was in its infancy. Her book publications, to name a few, are IAP Copy Bible Book, Textbook of Adolescents, and Mental Health, IATPAH Book of Nutrition by IYCF, Manual of Early Childhood Development, ECD, and various modules of Central IAP. She is very enthusiastic, a warm person, very much lovable. Thank you very much, ma'am, for accepting our invitation as chief guest. Our guest of honor is Dr. Jayant Pandharikar sir, our president-elect of Maharashtra AHA. He is a practicing pediatrician, a noble heart person, God-fearing, and was our Maharashtra IAP president in troubled times of COVID. And he had continued to be navigating Maharashtra IIP throughout COVID times for 2 years. He is executive member of Central AHA in 25-26 and a very good pediatrician from Amravati. He has contributed 14 IAP modules and book chapters in IAP textbook of adolescent pediatrics, as well as coffee book and parental guidelines. May I request our chief guest, Dr. Sushma Desai ma'am, to share her pearls of wisdom. Over to Dr. Sushma Desai ma'am.
Uh, Very good evening. Very, very warm greetings from my side. Thank you, Dr. Chitraji, for all those very lovely words of introduction. I am a part of your family. That is the only introduction which I would like to have from all of you. It's lovely seeing you all on the virtual platform. And I do look forward to meeting you all when we meet for the CME, Adolescent Health Conference, which is being organized under the leadership of Dr. Chitra ji. So once again, I extend my warm greetings to all of you, Dr. Chitra ji, Dr. Shama, Dr. Sangeeta ji, Dr. Neha, Dr. Deepa Shri, Dr. Jayant Bhai, and Dr. Sadachar, and all who are present on this platform. Actually, I would like to congratulate all of you for choosing a very, very apt topic. Why? Because the adolescence, it's a powerhouse of potential, powerhouse of energy. We all know that. But the channelizing, the harnessing of that energy and that potential sometimes go haywire. Actually, risk-taking behavioral pattern is not just the behavior. It is biology, more or less. Why? We all know about the asynchronous neurobiology. We all know that the reward center, which is quite early and fully developed, the hormonal surge, the urge to experiment and explore. These are all the factors which would, I think, push the adolescents to take chances, to do some of the behaviors just for an exploration, just for the thrill. So I think that makes them highly vulnerable to the risk-taking behavioral pattern. But what is the answer? We, the pediatrician, we are the gatekeepers, and a very important one, if I am not mistaken. The answer lies in very simple but powerful things: listening without judging, building trust with them, creating a bond, creating safe spaces where the young people feel comfortable opening up, sharing their thoughts. Sometimes even one meaningful conversation can change the direction of that very, very precious young life. So we can be a very powerful instrument harnessing that energy and potential from a harmful risk-taking behavioral pattern to the useful one. They can achieve heights in sports, they can achieve heights in academics, they can be the best scientist, and they can be the best citizen. So as healthcare professionals, we have that opportunity every single day. And friends, let all of us grab that opportunity. I'm sure today's session will give us practical insights and tools to better support our adolescents. It's not just as a doctor, but as a mentors and the advocates of adolescent health. Thank you once again to the organizers, and I wish this webinar a great success. Let us all work together to turn this so-called turbulence, which is such a famous word when we talk about the adolescents. Let us turn this turbulence into an opportunity for the healthier, stronger, and probably more confident young individuals. Thank you so much, and looking forward to having a great session ahead. Before I stop, I would like to share my affectionate regards to a very, very dear friend of mine, Dr. Atul Kanekar, sir. Sir, it's not just a pleasure, but it's such a thrill seeing you on this virtual platform. Thank you, sir, for joining.
Bye-bye.
Yeah, we request Sushma ma'am to remain logged in because lot of questions we will get here, and we will be happy if you also be present to answer it, ma'am. Now I request Chairperson-elect Dr. Jayant Pandrekar sir to share his thoughts in few minutes.
Thank you very much, Dr. Chitra madam. Respected President of AHA and Dr. Sushma ji. Just now I could see even Dr. Shamik Bhai is there. our Secretary of Central AHA, Dr. Shamik Ghoshi, Dr. Atul Kanikarji, then Dr. Shama Madam, Dr. Deepashri ji, Dr. Sangeeta ji, Dr. Neha, Dr. Sadachara, and all. At the outset,
Dr. Sneha Gadkar ma'am is also there.
yeah, Dr.
Welcome,
Sneha
ma'am.
Gadkar is, madam is also there. So at the outset, let me welcome you all, on especially the Central AHA office bearers, on behalf of Maharashtra AHA, to this prestigious webinar of Maharashtra, monthly webinar of Maharashtra AHA. The today's topic selected is on risk behaviors. We all know the cardinal features of adolescence is autonomy, identity, experimentation, and the exploration. And this is the age, all these things that it matters, and which lands up adolescents in the risk-taking behaviors. We all know the commonest cause of morbidity and mortality in adolescence is a mental health, and the most important factor is poor development of the prefrontal cortex, especially the ventrolateral aspect of prefrontal cortex, which is responsible for the mainly for the reward things. And that's why most of the adolescents, they tend to go for the risky behaviors. In addition to that, we have various risk factors in today's era. Especially, there's a peer pressure, there's a media pressure, there's a societal pressure. Of course, the family environment also plays a major role in these risky behaviors. And on top of that, the adolescence is going through the phase of mental stress throughout this period of this adolescence. So who else can talk about these risky behaviors? Of course, we pediatricians can talk these risky behaviors to the parents, and definitely, as Sushma Madam has rightly said, is a pediatricians, we must talk to the parents. At the same time, we must talk to the teachers, we must talk to the society, so that definitely we can curtail down the risky behaviors, not drastically, but to some extent, so that they cannot cause harm to themselves or to harm to others. So I'm eager to listen to our today's speakers, Dr. Shama Madam and Dr. Sadacharji. So with this, once again, I thank the organizers for inviting me. Thank you very much. Madam, please call.
I'm sorry to interrupt the procedures. I'm sorry, my audio video had gone haywire, so I could not reply to Dr. Chitraji. Yes, Dr. Chitraji, I'm there till the end of this webinar, so don't worry about that. I will be there. Thank you so much.
Thank you, ma'am. Thank you. Over to
Chitraji, we have Dr.
Deepashri.
Shamik ji is there.
Yeah, Shamik sir.
No, thank you so much, Dr. Chitra Kulkarni, Dr. Jayan Pandrikar, Dr. Atul Kanikar, and all the seniors. Our chairperson, Dr. Sushma Desai, is the chief guest today. So it's a very wonderful deliberation that everyone will be very eagerly looking forward to, because a lot of what we talk of as high-risk behavior in adolescence is physiological. And yet, how to tame this physiology and how to give them a direction so that they ultimately emancipate into responsible adults. That will be the journey that we will look forward to. My very best wishes to Maharashtra for this wonderful monthly initiative. I'm really looking forward to seeing all of you at your zonal CME in June. Thank you.
Thank you, Shamik sir. Welcome, Dr. Ramakant Patil sir. And welcome all dignitaries. Nice to see you all. Now, I will just introduce in short today's chairperson, Dr. Sangeeta Lodha Madam. Dr. Sangeeta Lodha Madam is convener of National IIP Women Pediatric Forum. And last year, Madam has given around 15,000 HPV vaccine to adolescent girls in UP and Maharashtra. And Madam is working desperately for thalassemia awareness and self-defense awareness also. And Ma'am is known for her remarkable energy and exceptional ability to manage the multiple responsibilities at a time. Welcome, Ma'am, and I will request Ma'am to introduce today's speaker, Dr. Shama Kulkarni Ma'am and Dr. Sadachar Uzarankar sir. Sangeeta Lodha Madam, please go ahead.
Please unmute yourself. Dr. Sangeeta ji.
Thank you, Dr. Deepa, for this nice introduction. Just I want to make a little correction. Till date, I have given 25,000 HPV vaccine pan India instead of 15,000. Today's topic and the speakers, definitely they are legendary from the Nasik AHA. First, Dr. Shama Kulkarni madam. She is a senior most pediatric adolescent consultant practicing since last 40 years in Nasik, and she's the national trainer for the breastfeeding and counselor. She has given till date more than 2,500 talks for the parenting. She has written 2 books also in parenting, that too very big in the beginning when she has started her practice. So almost 35 or 40 years back, she was the past president of AHA Nasik and IP Nasik. Then she has received so many awards. It is really, I'm amazed to see the list of awards. Gupte Award by the Citizens Forum, Rashtriya Shiksha Sanman Award, Adarsh Mahila Award, Santanu Rao Kirloskar Award, Tejaswini Award, Doctor's Lifetime Achievement Award, Matru Gaurav Award, NB Kumta Award, and so many lists. It's a huge list. If suppose I used to read all this, it will take so many times. So this is the first speaker of today's program, and then second speaker is Dr. Sadachar Ulamkar, senior pediatric consultant, who is the director of Aditya Children Hospital and the Chiranjeev Children Hospital, the Government General Hospital. She is doing a job in Government General Hospital, Secretary of IP Nasik in 2016, and then Honorable Treasurer in MAHA AHA in 2017, when it was a era of COVID, and chairperson of a and he was chairperson in a scientific committee during the Adolescents in 2025 and 23 when it was conducted in Nasik. So I request Dr. Deepashri Tatar to please proceed for the further moment. Thank you.
Hello. Now I will request our first speaker, Dr. Shama Kulkarni ma'am, to start your session. Shama Kulkarni ma'am, please share.
Yes, I am sharing the screen.
Yes, ma'am.
It's not
We
becoming
can
full
see your
screen.
screen, ma'am. We can see your screen.
You can see? Okay.
Yeah.
Yeah.
Nice.
Good evening, everyone. First of all, I'm thankful to Dr. Susma Desai ma'am, Jayant Pandrikar sir, Sangeeta Lodha, Dr. Chitra Kulkarni, Dr. Shramik Ghosh sir, Dr. Sneha Gadkar, Dr. Atul Kanekar, Deepashri and Sadachar for organizing and giving me the opportunity to talk about such an topic. After all, why all of us are discussing about this topic? What is importance? The risk-taking behavior of adolescents is getting echo. Deepashri, I'm getting echo. This behavior is on race. Is it a normal phenomena or deviation or abnormality of adolescence? It's not abnormal, a developmentally driven phenomena. It's absolutely a part of life of teenage. And this is impulsive reward-seeking behavior. And there is lot of peer influence. And adolescent age group, as we know, 10 to 19 is a phase of rapid physical, emotional, and social changes. Psychological changes are taking place. The teenager is just remaining amongst peers and not listening to anybody. And they just want to satisfy their friends. And this is just curiosity. There is peer influence and there is risk-taking tendency. So it makes the teenager vulnerable. And please mute all. So it increases the vulnerability and this is just developmental expression. So what are the high risk taking behaviors? These are the behaviors. These are the actions which a teenager takes. These are harmful for the teenager's health at present as well as for future. And not only for the health, for his social life, for his complete life, it can have detrimental effect. That's why we are worried about negative outcomes which can harm his safety and his development or her development. So, what are the common types of high risk behaviors? We are going to discuss that. But before that, along with the telling all those things, I'm going to share my few cases, and shortly I'll come to why this behavior happened and what are the reasons behind it and how we can prevent it or control it. So coming to substance abuse, use of tobacco, alcohol and drugs, I remember one child who was brought to me by his parents. The parents all of a sudden on one fine morning received a phone call from the principal, and they were told that child is not coming to the school for last 8 days. They were shocked. It was well-to-do family, joint family, and the child was having good rank. The child was first ranker throughout the career till 7th standard, and nowadays the rank marks were falling, but they thought that we are not going to bother our son, let him score whatever he wants, let him we are not going to have any burden upon him, and they just neglected that. And all of a sudden they were shocked to know that he is not going to the school. And then everyone started searching for him, and he was found with peers at some weird place. He was found enjoying smoking and drinking. So everyone was worried, and the child came to me. Then another practice, high risk behavior is unsafe sexual practice, which we come across many times. Then aggression and violence we see in many children. As a pediatrician, they approach us and they just tell us, इसको कुछ बोलो, ये कैसा बर्ताव करता है, हमेशा हमसे बैक आंसर करता है. ये तो this is day to day practice. Nowadays, we see cases of digital addiction, risky online behavior, risky use of social media, and cyberbullying. For this, I remember one girl who was in 10th standard, and she just closed her room and sat inside the room for 15 days. She just used to open the door for eating or doing something, but she was not allowing anyone. The mother was staying with her. She was the only child and the father was abroad. So mother was worried about her behavior, and she was continuously gaming and using mobile and not going to the school and not going to the tuition classes. So this sort of behavior we come across many times, and this is very common. And reckless driving, this reminds us a case at Pune, who was a 17-year-old boy, and who was driving under influence without license, and he killed two people, two persons. So that case we remember. Then risky use of social media, then eating disorders. Eating disorders are also very common, and for that also I remember one case who was appearing for 12th standard, and she was staying at hostel, and she came home after the exam was over. She and her mother were used to stay at the one bungalow, and mother was divorcee. When the girl came back from the hostel, she was shocked to see her stepfather sitting in her bedroom. And then she was just mad. She just started headbanging. She stopped eating and she became violent. So she was brought to me. So such many cases we experience in day-to-day life. So what is the current overall scenario in India? The types of HRBs are increasing. There are many studies I have seen in which were published in journals, and that indicates 13.1% of Indian adolescents are involved in tobacco, alcohol, cannabis, opioids before the age of 15 years. Then unsafe sexual behavior, it is increased, and it is seen that 15 to 14 years of boys are having multiple partners. Then risky road driving, reckless driving is also common at not using helmets, 42.6%. Texting while driving is also very common. Many times, if we are in cab, we have to tell that cab wala, don't use mobile phone while driving. Alcohol drinking and driving, that we see on the road many times. Then digital mental health risk, it is very common, and we are just afraid of the teenage behavior with mobile addiction. Violence and self-harm also common. Approximately 8.7% of the surveyed youth were showing suicidal ideation. So, high risk of online media and sedentary lifestyle, these increase the risks among young adults. So, what are the potentiating factors for high risk behavior? Many times, adverse childhood experiences develop the child in a different manner. There is childhood trauma, the child has witnessed violence, the child has seen father beating his mother, or both fighting together, or they just fight and then they just blame the child and they start beating the child. Such harmful experiences make detrimental effect on child psychology. Then experiencing domestic abuse. Many times this is seen in peripheral areas. Then both significantly correlates with higher rates of violent behavior in teenage, because they grow up seeing all those things. They see that if you are angry, just shout at somebody, just uh, uh, raise your voice, use bad words, and then start beating, throwing something, and whatnot. So this violence is taught to them by parental behavior, and they start behaving in the same manner. Then urbanization and social shifts are also contributory factors. Then social stigma to gain the access of mental health supports. This remains a major barrier, because if somebody is having weird thoughts, somebody is behaving in a different manner, still they are not ready to approach a psychiatrist or even adolescent pediatrician. They just hide all those things, and the problem becomes more serious. If we compare males and females, the risk-taking behavior is seen in more in males. 42.1% is the ratio in males, whereas 16.1% in females. And usually studies were done in students, so 30% HRBs were seen in students. And this is increasing at earlier age nowadays. So why adolescents behave in this manner? Why do they take risk? The main important factor is biological factor, the brain development. It is the most important point which we know. At adolescent age group, the limbic system is high and prefrontal cortex is yet to get mature. So now let us think of that first case of the boy of 8th standard who was found enjoying smoking and drinking. See, the boy was told by his peers that you bunk the school and come with us. So the boy started thinking. Then they told him to smoke and drink. A threat was created to the amygdala. The amygdala at this age doesn't recognize whether the threat is true or false. What was the threat? The threat was either those friends will be with him or they leave him. they will just end his friendship. So he was worried they will ridicule him, they will leave him, they will just not take him in group and he will be rejected. And that feeling of being rejection was a threat. तो क्या हुआ? ये थ्रेट जब एमिगडाला को मिला तो जज के पास गए. जज इज प्रीफ्रंटल कॉर्टेक्स, द जज इज इमैच्योर, अंडर एज. तो जज ने क्या डिसीजन दिया? जज के सामने आया, either fight or flight. So what he should choose? Flight. Go away, run away, say no to them. This is the correct response. लेकिन जज क्या था? इमेच्योर था, अंडर एज था. जज ने क्या बोला? Just fight, go ahead. So he accepted the challenge and he just left the school and went with the boys. Now what happened? Here comes the role of reward center. So reward center is at high. He just smoked one cigarette. The boys appreciated. So reward was there. Dopamine was released. So again he smoked second, then third, and more dopamine, more and more reward, and vicious cycle and addiction. So he did this on one day, second day, third day, and 8 days. He didn't go to the school. He was with those boys. So this is how the limbic system and prefrontal cortex are behaving. The prefrontal cortex is not yet mature, but the limbic system is at high. One more research is done, and it shows that at this age, the child understands the detrimental side effects. He has that logical understanding that this is not good, but because his cognition is not developed, he cannot make perfect decision. So, I can share you one more case that one girl was, throughout her school age, she was topper. She was just getting 95%, 98% and whatnot. In the exam of 10th standard, her parents pressurized her that you have to keep your score. Your score has to be above 98%. Otherwise, we won't let you have college admission in your degree of choice. You will have to do whatever we say. If we ask you to get married, you will have to get married. And she was worried. She was so much under pressure. So the threat was created. The limbic system went for decision making. Prefrontal cortex gave wrong decision. चलो, पेरेंट्स के एंगर की जगह एक बुक तो साथ में रखो, एक भी मार्क नहीं जाएगा. So wrong decision was taken. She kept the book inside the hall, examination hall. She was rusticated and the whole family went in depression. So this is how wrong decision is there. But on the back of that, parents are always there. आपके हाथ में मट्टी दी है तो मट्टी को शेप देना भी आपका काम है. So parental decision is important. Parents have developed prefrontal cortex. They can make good decisions. And here comes the role of parents. So why we have to understand all those things? If we understand this, not only we, as each and every parent should know this, that child is looking of the height of looking just as us. हमारे जितना ऊंचा दिखता है, इतना समझता नहीं, इतना सिंपल समझता नहीं, तो नहीं समझता. He cannot make any decision. He is emotional, he is sensitive, and that is the key point of adolescent's life. This is the turning point of his age or her age, and at that time, parental role is key role. So, I have talked about this dopamine reward system, and strong reward sensitivity is there. The child is just happy if somebody appreciates, and this is done by parents, and this is done by peers, and sorry to say, not by parents. And that's why the risk-taking behavior is on the rise nowadays, because parents don't have time. They are just engrossed in their mobile and their personal life. They just sit in two rooms and text each other what is to be ordered on Zomato, and they just don't know what is going on in child's life. So child is left alone, the teenager is left alone, and he has to seek appreciation from the peers and outside, and we don't know how the company is going to be. So this is what is happening. So what we have to do, what parents have to do, we have to be watchful for red flag signs. If there is sudden behavioral change, mood change, personality change, then you should seek doctor's opinion. If there is academic decline, don't say that we are not bothered about your marks. You just investigate why there is decline. Then you don't pressurize. At the same time, उसे ज्यादा burden नहीं देना है, उसे torture नहीं करना है, but at the same time you have to be watchful, you have to supervise why the grades are falling, how are his friends, withdrawal from family and friends, are we too strict, are we not talking to the child, are we not having good communication. Then any changes in sleep pattern or appetite changes. If the child is sleeping till late 9 o'clock, 10 a.m., or the child is not sleeping early, the child is awake till midnight, 2 p.m. or 2 a.m. at night. So we have to be worried, and we should consult adolescent pediatrician. Then irritability, aggression, चिड़चिड़पन आ जाता है. The boy or girl who was very nice and goody suddenly start getting angry and suddenly show violence, then it's alarming sign. Then secretive behavior, impulsive behavior, lying many times, bad peers also, they make the child steal money from home and do something wrong. So we have to be watchful and aware of all those things. And obviously physical signs of self-injury and harm. So this is the chart where you can find the risk factors and protective factors. So we have to be aware of how we are behaving. Parents should monitor and support and should retrospect whether the parents are having some addiction, parents are alcoholic, parents are having some conversation in front of the child, not communicating properly, or they are not engaging in healthy lifestyle. So all these things, low academic achievement, sexual abuse, mental health issues, and association with delinquent or substance use peers should be watched for by the parents. And family rejection or sexual orientation, gender identity should be avoided. Then poor parental monitoring is also not good. Parents have to be watchful. And obviously, the history of substance use in family is also important. Is the risk-taking behavior always bad? No. It convert the calamity into opportunity. Risk-taking behavior is a phase in the teenage, and if it is utilized in positive way, the child can be in sports. Those who are topper remain topper. Why? Because they need appreciation. They are happy with appreciation, and to maintain that appreciation, they just try to excel. They just try to win the race. So leadership, trying to experimenting new activities, public speaking, then support skill development and resilience. All those things can be because of just risk taking. So risk taking is not bad. Risk taking, it should be calculated risk, and it is done only with parental support. If there is good family environment, good communication, good family support, then the child's life can be beautiful. So thank you.
Thank you, Shama ma'am, for very insightful and really awakening session for all pediatricians, doctor, as a parents, as a mentor. So we all came to know about the high risk behavior causes, its potential factors, and why it occurs in adolescent age group. Now everyone is eager as to know how to manage this high risk behavior, and that is very important. Every parent, every pediatrician, every family member is facing now day to day, and it is increasing down the line from previous. During our childhood, it was not that a major problem, but now this problem is increasing because of number of factors. So everyone is eager to hear our next eminent speaker, Dr. Sadachar Udarankar sir. Sir, please start your session. Thank you, Shama ma'am.
चल लवकर.
My screen is visible to everyone.
Yes, sir.
Yes, sir. Your screen is visible.
Okay. First of all, thanks a lot, Maharashtra IIP, Maharashtra AHA, for giving me the opportunity today to talk on this strategies to manage and deal with the high-risk behavior. First, I will just acknowledge all the dignitaries of Central AHA as well as Maharashtra AHA as well as my team, Nashik AHA team. Dr. Pankaj Chavan is here. He is a secretary, and Dr. Bhakti is there. He is a treasurer. So I welcome all of you, and I'm very much thankful. So talking regarding the strategies in just 15 minutes is really a very challenging. It is definitely a challenging task, but I have tried my best to highlight important points, and I may read out some of the headings only. So please don't misunderstand, because it will take a lot of time to elaborate each and every heading which I have included in these slides just for the information, but that important points I will highlight. So managing high-risk behavior, it requires definitely a balanced, structured, and empathetic approach by the caretakers, stakeholders of adolescent health. Important is you need to first set the goals while managing. So you have to understand the causes of particular risk behavior. Not all cases are same, and not all in fit phenomena can apply in managing. We have to evaluate each and every case differently, but there are some common parameters that we can assess. So we need to build safer coping skills. We need to stop or mitigate severity of the behavior. Then first we need to assess very comprehensively and what the risk, what the case is. The first parameter, that is a tool developed by all adolescent health workers as well as the researchers, that is the HEADS, is a structured psychological screening tool used by clinicians to evaluate risk behaviors and protective factors in adolescents. Mainly it is important in face-to-face interview, because there are many treatment modalities which are online also today, but the HEADS applies more effectively when it is applied from face-to-face interview. Then we need to assess the type of behavior, what are type of behavior the child is exhibiting. Then how is the frequency? According to frequency, we can assess the severity also of the risk behavior. Then we need to see the triggers. What are the triggers of particular risk behavior? Triggers may be the peer pressure, societal factors, then intense curiosity, as ma'am has rightly described, is a reward center. Reward center is very active in adolescent brains. So curiosity, then desire to establish new identity, meaning these triggers can be top factors in developing high-risk behaviors like smoking, alcohol consumption, drug use. Then what are the maintaining factors? There are triggers and there are maintaining factors also. So what are maintaining factors? Maintaining factors, the foremost is desire to fit in. and gain social acceptance. Image building as a daring individual. Amitabh Bachchan. I am Amitabh Bachchan. Nobody is lesser. Nobody. I am bigger than everyone. So that is the thing, that emotion, that instinct is so strong in adolescents that they have to maintain. They are under constant pressure that to maintain this whatever they this thing. Then mental health, yes, pure mental health issues definitely predispose one to develop high-risk behaviors, family issues, family conflicts, school issues like in school, if the child is showing the less scholastics, meaning lesser scholastics, definitely there is some kind of stress we need to find out. Then in a peer context, if there is a bullying at school, then bullying can cause mental health issues in the child, in the adolescent. So let us briefly summarize what is heads, because unless you assess the child, you can't go for the management. Exactly what the problem is, we need to diagnose, and then only we can suggest the strategies and management strategies to deal with the thing. So first is the home, source of risk or protection. That can be both. As the ma'am's last slide was, that the risk factors and the protection, there is the role of home environment is in both. That is developing a risky behavior or developing a highly productive risk, meaning positive health risk also. Positive risk behaviors also. So family, if there is a family conflict, if there is a lack of supervision, definitely you are more prone. Unstable home, higher risk of substance use, running away, our mental health issues can be there. Education, early warning signs, education, the progress in the education shows the early warning signs that if there is a poor performance, then definitely you need to find out whether the child is stressful, having low self-esteem issues. When there is a mental health issues like depression, anxiety, or tendency to self-harm, you have to rule out the bullying, whether the child is experiencing bullying. The activities, that the third the third point of HADES assessment, the activities, very important. Peer influence zone, because children are more and more prone with to spend time more and more with their friends. So peers influence highest with the any development of behaviors in the children. Then drugs, poor risk behavior, definitely getaway behavior leading to violence, unsafe behavior. As I said, mental health problems, we are not to assess. Then sexuality, we can't ask direct questions, but we can ask some open-ended questions, sensitive but crucial issues, but we need to handle it very delicate. Then the risk link, lack of knowledge or unsafe sex, that we'll see in the cases. I have put in some cases also. So safety, that is the last point, a direct risk exposure, immediate threats requiring urgent attention. That means the child is either violent, reckless driving, and also the unsafe sex. So in this, I have just briefly mapped, I have done the brief table that high-risk behavior mapping according to various domains of the HADES the assessing tool. That is the home domain, how it assesses the risk behavior. I will go ahead because of lack of time. Then in management, first I have taken this point that high-risk cases. Basically, what we need to manage is when there is a crisis. What are crises? When there is a high emotional surge, these adolescents can do anything to themselves as well as others. When it occurs with others, it becomes a violence. When it occurs with themselves, it becomes a self-harm or suicidal attempt. So first is to prevent immediate harm, reduce the harms, meaning reduce whatever. First is to, meaning that management strategies. Let us go back to the next slide. In goals of risk crisis management being ensure immediate safety of the adolescent, reduce the risk of harm, remove access to harmful means, and supervise that child if you find a risky thing there. Then provide clear stepwise actions like calming, grounding techniques. Grounding techniques is excellent, you can say, the solution to immediately decrease the surge, the emotional surge which the adolescent is going through. The details are difficult to say here, but we will definitely discuss sometime. Strengthen support system, very important. Active listening. There is nobody in the many children's surrounding, to listen to them. So validate their feelings. Yes, definitely. If the child is not feeling well because of something, or well meaning emotionally well, then you can definitely say that I can see your on face that definitely you are disturbed or by something. That becomes the validation of the feeling, and definitely that reduces the surge, the emotional surge, and we can take over the crisis. And again, to prevent recurrence, there are different modalities to prevent the recurrence. This is the crisis management. These therapeutic interventions I have categorized into 4 levels: individual level, then family level, school level, community level, peer intervention level. Meaning 4 main levels, and these peer interventions I have specifically added because this is very significant intervention and definitely needs special mention. So for managing this high-risk behavior, the path of recovery from teenage risk behavior often involves a multifaceted approach, but there is no one size fits all solution. And the most effective management plan will depend on specific needs and circumstances of individual. And we need to fit in. We need to tailor-made it according to the case. So let us go to the first level of intervention, that is individual level. The first is the building therapeutic alliance. This is very important. Just in short, build the trust in the child, be empathetic, build good rapport, be non-judgmental, calm, and confidential, because they don't like sharing their private information with anyone else other than the counselor or the caretaker. So I already told that use open-ended questions, avoid blaming, that is very important, and lecturing. Active listening, already told, validate feeling, avoid confrontation, and respect autonomy, but ensure safety. Then psychoeducation, explain consequences of the behavior, whether the short term, what are the consequences, and the long term. As the ma'am has given the example of smoking, definitely we can say that short term you will have a dopamine rewards, but in long term you will fail. So these are the very important to give them explain them regarding the consequences. Then correction of myths, for example, that desire to fit in, how much it is justifiable to fit in. That is the question we should ask to the adolescent. Then use age appropriate and relatable examples, definitely. And then there is one part that is known as motivational interviewing, that builds the internal motivation and explores you can explore the ambivalence by asking, what do you like about this behavior and what worries you about it? So it helps adolescent to move from denial. Many times if you say to them stop smoking, they will not ask, they will not follow. But if you discuss with them various issues and various and in question answer format, then definitely that denial definitely shifts to the readiness to change, at least to reducing the severity of the behavior, mitigating the behavior. I am going very fast. Basically, there are many details also in these all things, but I am just giving the intros of all the therapies. Cognitive behavioral therapy, thoughts, feelings, actions triad. Identify negative or harmful thinking pattern, definitely challenge it. Challenge your thoughts which are irrational and replace it with realistic, rational thoughts, and there is ultimate modification in behavior. Then most important part that I am coming, that is the life skill training, one of the most effective primary prevention strategies to reduce the high risk behaviors. WHO definition, I have to say here that life skills are abilities for adaptive and positive behavior that enables an individual to deal effectively with demands and challenges of everyday life. Then there are different, these emotional life skills, thinking life skills, and social life skills. Then why life skills matter in adolescence? Because basically why adolescents engage in these behaviors, that we need to understand. Because of their peer pressure, poor decision making, emotional instability, identity confusion, and brain development, the stage of brain development as ma'am has rightly described already. Then the life skills help them where they start thinking before acting, they resist pressure, they handle stress well, and build confidence. So just in short, every life skill I have categorized here to how it changes the behavior. Decision-making and problem-solving life skill helps to avoid impulsive, risky behavior. Meaning, once the life skill education is done, the adolescent tend to ask, should I try alcohol? Because this question doesn't come to his mind before the life skill education, because that has never been introduced to him. Then again, the critical thinking enables one to evaluate media or peer influence, identify myths versus facts. Media is most powerful today, and so there are many myths on the media, which is difficult to elaborate now. But because of that, the generation is getting spoiled like anything. So tackles digital addiction, critical thinking. Then creative thinking finds alternatives to risky behaviors and channels energy positively. Communication skills, it expresses feelings clearly and seeks help when needed. That is very important. Interpersonal skills helps in building healthy relationships and avoid toxic peer groups. Then self-awareness understands strengths, emotions, triggers, and it builds self-esteem. Empathy reduces aggression, bullying, promotes pro-social behavior. Coping with emotions manages anger, sadness, frustration, prevents self-harm and aggression. And coping with stress, most important, that healthy stress management prevents substance abuse. So I have just very much shortly summarized all this, but there are many details of life skills that we need a lot of time for that. Then this is the very much steps that identify skill, how the individual level intervention occurs because of life skills. First, identify the skill deficit in the child, then counsel the child based on the required skill, and practice it. Practicing is very important. Just introduction is not important. To maintain it, to practicing and reinforcement and its application in life. Then there is a family level interventions. The most powerful intervention unit, we can say, the family assessment. And in that, basically, most important is that the family, parenting style, that is very important, because the communication pattern in the family, communication pattern of parents with the children, whether there are 4 styles of parenting. Out of that, authoritative parenting is the most ideal, we can say, to have mitigation or prevent the risk behaviors. Then there are many family conflicts. There are violences in the family, substance abuse in the family. That also affects the definitely the intervention that we need to find out. Then parent psychoeducation, how the adolescent brain is, that is the most important thing that they can't understand. Many parents, even well-educated parents, are not aware of, as the ma'am has said, कद तो मेरे इतना है लेकिन बहुत अलग सोचता है. So they can't understand that only physical growth is not the parameter for overall growth. So parent psychoeducation, how the adolescent is growing, that is very important. And how the risk taking is a part of, because risk taking is a part of his life, because positive risk taking spurts, meaning gains the more rapid progress of that adolescent actually whenever it occurs. So risk taking is not bad, but what risk taking, negative risk and positive risk, that we need to identify. Then early warning signs, we need to know the parents regarding there is this thing. Communication, most important. Calm communication with open-ended communication, non-judgmental communication is very important. Then parenting style, as I told, parenting, monitoring, and supervision. There should not be over monitoring, but at least parents should know which are the friends with the child is going, in which environment child is wandering. So family therapy is a very big topic. It reduces conflict, improves problem solving, and enhances the emotional bonding. Family counseling is coming up in metros in very high standards now, and that is working. Collaboration with professionals, if at all required, with those like psychologists, counselors. Then I just have 1-2 minutes for the EI skill, because it is a very important topic, that EI, how emotional intelligence works. And because without mentioning emotional intelligence, I don't think the management part is totally, I can say I have given justice to the topic. So first of all, I will say that the self-awareness leads to better recognition of triggers for risky behavior. This is then self-regulation reduces the impulsive decisions. Then the empathy improves the social sensitivity. Then the social skills enables to handle peer pressure and and social challenges more effectively. And motivation and goal setting increases the resilience and reduces the risk taking. These are the 5 basic EI skills that we need to take care of. And just as this brain development, we have already talked, the prefrontal cortex is fully developed in adults, but immature, and amygdala is more impulsive in teens, and adults less rely on this. That details all very well know. And the reward center, that is ventral striatum, that all is related with these EI skills. Then school level intervention, I will go a little fast because same thing we are repeating, life skill education, then risk behavior education, early identification, already ma'am has told, school counseling services that has to be improved. Then most important, I will say here that a teacher training and sensitization. As we train parents, we need to train teachers also because they are parents in the school basically. So we need to get them idea regarding again the same thing, how the adolescent brain is developing, how the risk behavior is important. Then sensitization, because there one sentence or one behavior can traumatize any sensitive child. So sensitization regarding to how they are reacting in the classes. Then anti-bullying program, very important. Parental involvement, structured extracurricular activities. Extracurricular activities is a very big subject, but extracurricular activities participation builds many life skills in the child. And so we need to have a very stress on extracurricular activities. Many foreign universities are giving extra grades if your extracurricular activities are more on the side. So inclusive, supportive school climate, collaboration with the health services if needed in severe cases. Peer education program is short. Young adults tend to trust and relate to their peers more than the authority figures. Definitely, father, mother, or whatever teachers. They more tend to follow their peers. So how it works? It works by relatability. They trust more on the peers, and the social influence is also more. So key components of effective peer education being the careful selection of peer educators, proper training, safe environment of them, focus on skill building and interactive methods with them to how to prevent these high risk behaviors, and community level participation, awareness and education campaigns, youth friendly community services, positive youth engagement program. This is a very, I think UNICEF has given one paper on this youth engagement programs. And then strengthening community support systems, safe and supportive environment creation, school community collaboration, very important, and peer support and mentorship program that I have already mentioned. So what are the take-home messages? Managing high-risk behaviors requires holistic, empathetic, and multi-level approach. Early identification, building trusting relationships, and strengthening are the life skills are key to prevention. Implementation of effective strategies at multiple levels and support and judgmental and adolescent-friendly environment is necessary. Supportive environment is necessary, and ultimately guidance, not control, and support, not punishment, lead to behavioral change and healthier transitions into adulthood. So with this, I just finish up my presentation, but there are some cases. If time is there, we can discuss.
Yes, sir. 5 minutes, you can take cases.
Okay, there are case studies. One that I have just jotted down, meaning this was last minute preparation by me, that case one. When Ajay, 16 years old, recently joined a new group of friends in junior college, and they often hang out after class, and drinking alcohol has become a part of their routine. So Ajay didn't drink earlier, but feels pressured to fit in. One evening, he drinks too much and ends up riding home on bike with a friend who is also intoxicated. So can we discuss, or I just tell you the next what happens? Anybody, any replies, any thought?
Sir, you only tell in precisely. That will be better.
Okay. Okay, this is the one case. So risk factors in this case are peer pressure, definitely. And there is as I said, desire to fit in, desire for acceptance is there. Lack of parental supervision is there, and the curiosity and sensation seeking as the brain matters. So the interventions what we need to do are motivational interviewing of the child, family counseling that we supervise, meaning at least keep some control or keep some supervision, keep some communication. Then school-based awareness the child into efficient peer groups, and peer pressure handling skill training is very important because this is another skill, life skill training, that peer pressure handling. So in this case, that is the thing. Then the case two, Aisha 17 is in relationship and feels emotionally close to her partner. They decide to have a sex but do not use protection because they feel it won't happen to us. So later Aisha becomes anxious about pregnancy and sexually transmitted infections. So what is happening here is that there is a lack of sex education. There is a myth that it won't happen. And there is a stigma that how can I go for open discussion? So there is a poor communication skill. And the intervention is comprehensive sex education, confidential adolescent health services, empowerment and assertive training, and counseling on consent and safety in this case. Then in case 3, Samir, 15 spends a lot of time online, connects with someone through social media. The person asks for personal photos and information. Samir shares them, trusting the person. Later, he is threatened that the photos will be leaked unless he sends more. Here, again, this is a digital media high risk case. The risk factors being the need for validation, as he's sharing the photos, and lack of digital literacy, poor parental monitoring. These are the risk factors. How we can intervene? We can educate the child with digital safety measures. We can educate the parents and also parental guidance and monitoring. That is very important. And reporting to the cybercrime complaint cell. That is important. And emotional support and counseling of the child. That is the thing. The discussion can go longer, but I just summarized in very short things. So these are the case studies. And if any queries, they are welcome. Thank you.
Very well explained, Dr. Sadachar. I just want to request Dr. Shama ma'am to give her talk, take home message for her talk, because she has not given us. And then we can just proceed for another.
Yes.
Dr. Chitra ji, may I leave because I have another meeting in the night, and we will have to, prepare for the same.
Your
thank
quick
you so much
comments, if
for
possible.
Madam,
If
thank
possible,
you.
quick comments, ma'am.
Okay. So, yeah, that was, first of all, I would like to, congratulate both the speakers for very, very elaborate, in-depth discussion, Dr. Sama ma'am, with a very, I think that is an experience or an age which prompts you to explain the things as if you are explaining it to the kids and the adolescents. That was wonderful, Shamaji. And you
Thank
can
you,
be a
madam.
treasure for the community programs. It was wonderful. And Dr. Sadachar, it was so very elaborative and very, very in-depth discussion on, how to address the risk-taking behavioral pattern. So I think that was a very nice discussion from both the speakers, and I feel so very proud of both the speakers. Looking forward to having more sessions from both of you. There are 1 or 2 points which I would like to make. Here, very important key home message will be we have to address the factors behind risk-taking behavioral pattern rather than the behavior itself. Because as Dr. Sadachar and Dr. Shamaji both had mentioned so many risk factors. Unless we address these risk factors, maybe the family, maybe the community, maybe whatever it is, unless we address that factor, the risk-taking behavioral pattern may increase day by day. Another important thing is referral criteria. See, the behavioral pattern can be a normal risk-taking behavioral pattern, which is so inherent for the adolescents. But we have to find out whether this risk-taking behavioral pattern has recently originated. Is it inappropriate for the personality of that child? Sometimes the child who is so, I think so, docile, cool, usually not indulging in a risk-taking behavioral pattern, suddenly start showing such pattern, and that too in a life-threatening manner. Very, very inappropriate. That is a serious sign of
self-harming behavioral pattern. So we have to immediately refer this child. कभी बच्चे ने कोई रिस्क टेकिंग खास नहीं बताया, ऑफ कोर्स छोटे मोटे सब बताते हैं, लेकिन वेरी वेरी इनअप्रोप्रिएट है ना, जैसे लाइफ थ्रेटनिंग होता है, ड्राइविंग द व्हीकल इन सच अ वे दैट ही इज इंटेंडिंग टू स्मैश और समथिंग लाइक दैट. तो ये जो है indulging in sexual act without protection, even knowing that this is going to create a real serious scenario in his life. So this all are kind of a very very the behavioral pattern which may indicate NSSI, the non-suicidal self-injury or even self-harming behavioral pattern. That is another thing. There are some tools we can use. I will share with Dr. Chitra ji some of the tools like Adolescent Health Risk Behavior Scale, which is a comprehensive Indian scale. Actually. It is mainly screening for road risk, tobacco, aggression, and diet-related risk-taking behavioral pattern. It's a very simple tool which we can use in a community screening programs when we go to the schools and the community. Another important thing is very simple, youth risk behavior surveillance system, which is also simple tool. It is a CDC tool and it is adapted for Indian urban context. Mainly it has been used in Punjab, some of the Punjab areas like Ludhiana and other stuff. And it was primarily used for the substance abuse, but now it is used, in country-wise for the risk-taking behavioral pattern. So these are some of the tools which we can use. And of course, there are some structured questionnaires also available, like RTI, that is risk-taking inventory, which can be applicable, which are very, which is available in Hindi also. We can use it in our office practice. So these are some of the tools which we can use to screen, apart from, of course, HEADS is the best tool to identify the earlier cases. So these are some of the, I think, comments, but everything was so very well explained by both the speakers that there hardly needs is a need of any expert comments. Thank you so much, and heartfelt congratulations to both the speakers. Thank you.
Thank you, Sushma ma'am. Thank you so much. Sadachar sir, very insightful and very awakening session. There is one question in the chat box, whether the nutrition is really required for physical growth and whether it is related to high risk behavior. Shama ma'am, nutrition is.
Yes, I'll answer both things. Sangeeta asked me to tell about take-home message and about nutrition. So nutrition is very essential as in context of high-risk behavior. When the child is malnourished, in the sense the child is obese, the child is not having all nutrients in the food. So the child is just rejected everywhere. The child is psychologically upset, and that background of psychology that can lead to high risk behavior. Secondly, if a girl child is there, she is adolescent and she feels that she is not looking good, she stops eating and she lands up in anorexia nervosa. Or if the child is upset and the child is facing some adversity in life, the child lands up in bulimia nervosa. The third thing is the child is not having nutritious diet. The child is having a low protein diet. The child is feeling weakness and the child is not able to think properly, rationally. Then in that case also, the child is like to land up in some wrong behavior. The child is not having all vitamins and the child is getting some neurological problems, then the child is anxious and then the child's behavior can be weird. The thought process can be weird. The child cannot think rationally. So all these things matter a lot. And on the top of that, the parents are just going to handle a child's behavior. So they should be aware of all those things. They should be watchful for all those things. And the most important thing is that they should give the message to the child that at the end of the day, they might shout at the child, they might beat the child, they might get angry with the child as human being. It might happen at times, but at the end of the day, they should give the message that I love you as you are. They should accept the child, and the child should know that he is loved by his parents. If this feeling of love is there, if this feeling of appreciation is there, if he knows that he is wanted at home, then he won't go here and there to seek appreciation in the peers and go for wrong decisions with wrong peers. So this message of appreciation is very important. पहले से ही बोल के रखा है, प्राप्ते तु षोडशे वर्षे पुत्र मित्र समाचरित. अगर घर में ही मित्र मिल जाता है तो व्हाई दे विल गो आउटसाइड एंड सीक फ्रेंडशिप फ्रॉम सम रॉन्ग पर्सन्स. बाहर तो बैठे ही है, तेरा बाप हिटलर है, तेरी माँ हिटलर है, ऐसा करके बिगाड़ने वाले तो बैठे हैं. But we have to be there. All of us are doctors, but all of us are parents also. So even we should experiment this at home, that we should give the feeling of being wanted to our child, and he should know whether the child is not performing well, whether the child is falling in race, whether the child is not bringing success, or whether the child is not looking good, looking ugly. It's okay. But that is our child, and he is loved, and that message to go to the child. Thank you.
Thank you, Shama ma'am. It was really wonderful session and awakening. Although we all feel that we know everything, we have means, like headache our kids, but still I always feel in every session we get some inputs. Finally, I feel how adults responds, how adults reacts, teaches the children how to handle the mistakes. If kids experience consistent, fair, and calm responses from the parents, they learn accountability without shame, and that builds their resilience. If adult responds thoughtfully instead of just punishing them, they can address the root cause, and that helps children develop healthier coping mechanism rather than repeating the harmful patterns. So not only as a parent, but doctor, as a pediatrician, as a mentor, everyone's role in society is very important in handling today's adolescent, because today's adolescents are only going to handle our country and whole world tomorrow. So we all need to be aware of it, because like in previous era it was like पौधा तो बढ़ता ही है, चाहे उसको जितना पानी मिलेगा, जितनी धूप मिलेगी, छोटा छोटे से बड़ा तो होना ही है उसको. But if you give nutritious in a proper way, in a proper quantity, in caring emotions, weather, surrounding, then atmosphere, just now Shama madam say, love, appreciation, and everything around, and that matters a lot in every child's upbringing. So, just a message to parents before giving vote of thanks: guide with love and stand.
Yes, Gachar has raised a hand. Just
Just
find
a word from guest of honor today. Jain sir, anything remarks?
Yes, sir, please.
Thank you, Dr. Sadachar. It was really an excellent presentation by Dr. Shama Madam and Dr. Sadachar. Truly speaking, it's a very big topic. What Dr. Sadachar has said, it's not possible to cover this topic in just mere 1 hour or so. But still, both the speakers, they have given justice to the topic. What I feel is that controlling risk behavior is in the hands of parents right from the beginning by educating them or imparting them the life skills at the very beginning of the life. What happens that till 5 years of the life, till 10 years of the life, we keep him as a child and just we pamper him. And we don't teach them these life skills, which are very, very important. And then suddenly we expect them to learn all these life skills from the age of 11 years and 12 years. And then we expect them to follow these life skills throughout. So we must impart those life skills in the very beginning years of the life, or in the pre-teen years of the life. That is what I would like to add here in this. So once again, congratulations to both the speakers and congratulations to Maharashtra AHA, Chitra Madam, Dr. Deepashri, Datar, Tatar, and everybody. Thank you very much.
Thank you, Pandarikas. Thank you for
Thank you,
your
sir.
valuable time. So I just want to say, vote of thanks to everyone. Today's esteemed chief guest of honor, Dr. Jayant Pandharikar sir, our esteemed speaker, Dr. Shama Kulkarni ma'am, Dr. Sadachar sir. Sadachar sir is, he is, expert in adolescent, and he has passed exam of adolescent care. And so, yeah, we got a very, so much of knowledge in AHA now. We need to have a workshop actually on life skill, and whole day workshop will be fruitful for we pediatrician actually. And so, Sadachar sir, you should think of it for at least for Nasik pediatricians.
Yes, yes.
And I'm also thankful to Neha, Dr. Neha, who is a support system for our digital backup. Dr. Pankaj, Dr. Bhakti, AHA team of Nasik, and all dignitaries who joined. Dr. Ramakant sir joined, Dr. Sulbha also joined, then Dr. Kanikar sir was also there. And so, number of parents are also listening to us. So, thank you everyone. And I will request Dr. Chitra ma'am regarding if any announcement about next session.
Yeah, the next May webinar has taken up by Solapur AHA branch, and it will be regarding the adolescent skin problems. Thank you.
Thank you, everyone. Now,
Thank you very much, Dr. Chitra Madam, Dr. Deepashri.
Thanks a lot, Chitra ma'am.
Thank you.
Thank you, Chitra
Shama
ma'am.
ma'am.
Thank you, Chitra ma'am.
Thank you, Sangeeta.
Everyone.
Thank you for
Everyone.
being there throughout the
Yes,
webinar. We
yes,
are really
yes. Thank you. Nice to see Sangeeta ma'am. Thank you for your active support always.
My Nasik, my pride.
Yes, yes, yes.
Thanks a lot, everyone.
Thank you.
Hello. Bye, bye. Bye.
Shall we end the meeting?
Yes, please.
Yes, yes, ma'am.
Thank
Yes.
you.